Welcome back, guys. Tony Maritato here again. Let's talk about equipment, adaptive equipment, DME, what you're going to need, what might be covered by insurance, what might be self-pay. So walkers, crutches, canes, these are standard pieces of equipment. I can tell you that typically insurance will pay for a walker or crutches. You or your therapist or your surgeon will determine what you go home with. Most of the people here in the US are going home with a standard forward wheel walker. That is the walker that has the wheels in the front, skids in the back, two handles to hold on to. It's the walker you always see. Occasionally, younger individuals who have a knee replacement, who are more agile, more mobile, they might go home with crutches. I can tell you in 20 years of outpatient physical therapy, I think I might have seen one patient with crutches after a total knee replacement. All the others have had a standard forward wheel walker. Walker gives you more stability. Walker gives you more safety. It lets you lean on it. And so it's the best kind of all-around option. Some people will migrate from a walker to a cane. Typically, insurance will not cover a cane, but a standard cane, an adjustable cane, can typically be purchased for about $10 to $15 on Amazon or Walmart. I'll put some links for different equipment in the buyer's guide that'll be attached to this module. So let's see where we are here. It's highly recommended that you contact your insurance company, of course, to find out what's going to be covered. For patients with hip replacements, we're going to skip that. But even with a knee replacement, an elevated toilet seat, a bedside commode, these may be important pieces of equipment for you, depending on your current functional level, depending on how you're going to respond to the procedure, how you're going to respond to the medication. If you're feeling dizzy and nauseous, it is not safe for you to be going from bed to commode to the bathroom without, some direct supervision, without help. And so a bedside commode might be a huge benefit for you. It's not known because every insurance policy is different, whether insurance will pay or not, but I'll post a link to some of my favorite bedside commodes and we'll talk about how you can use those also in the shower. So let's talk about personal aids. What's typically suggested and recommended? So the walker we mentioned, a cane, a reacher or a grabber. That's the thing that's got kind of like a handle, trigger, and these little pinchers out at the end. You can get long ones, you can get short ones. Crutches for some people, but that's not often. A sock aid is a device that will help you put your socks on if you can't reach over to get your socks. As a person who's having a knee replacement, the biggest factor is depending on your hip range of motion, depending on your knee range of motion, you might need some help with this. Long-handled shoehorn, elastic shoelaces. Certainly, there's other stuff. We'll finish this list, but I'll mention shortly. In the bathroom, we talked about an elevated toilet seat. Toilet risers with handles on the side are great additions. A shower chair, something safe that allows you to get into the shower. The grab bar for the shower or the tub. A handheld shower head. That's the one that's got the long hose that attaches. You can bring it down, kind of use it wherever you need it. A long-handled shower sponge to reach those hard places. Other things that they don't mention here, but super common, super effective. Depending on if you're somebody who likes ice, likes cryotherapy, you can get a machine that will circulate cold water through a cuff that goes over your knee. You could get a gel ice pack that never gets hard, but you can use in and out of the freezer. For somebody who doesn't like ice but enjoys heat, you might use some sort of a hot pack, moist heat. There's lots of things like that. There's certainly patients that benefit from a TENS unit. There's different devices that you can use to help modulate pain. I will do my best to provide a comprehensive list, but if you're not already in the Total Knee Replacement Support group on Facebook, it's a free group to join. It is a private group. But once you join, there are lots of resources in this group of patients who have been through this procedure, who have made their own list of must-haves, nice-to-haves. Go check it out, because there's nothing worse than being 48 hours post-op and thinking, oh, I wish I had this, and then you don't get it for another 2 or 3 days. So this is a great resource. Before surgery checklist. I'm a huge fan of checklists. Let's take a look at some of this, and then this will be saved as a separate document for you. To complete before surgery, have I verified insurance? We want peace of mind. We want to know what's going to be covered, what's not. Have I attended the total joint replacement class? This is the class, so check it off your list. I've received my pre-admission test schedule. Right now with COVID, you probably have to have a COVID test. There's going to be other blood work and things that you need to have done before the surgery can take place. I've completed all my lab work that my surgeon's office requested. I will call, well, you don't have to worry about this unless your hospital offers this specialty care coordinator if I have questions about surgery. I've talked to the coordinator about discharge options. You want to know, are you going to go home? Are you going to go to a skilled nursing? Are you going to stay in the hospital for a night or two? Get those answers ahead of time. I've completed a living will with care and power of attorney to have on file in my chart. Nobody wants to face that reality, but these are important documents that need to be there, because if they're not there, it puts your family members in a tough position. Have the power of attorney, have the living will, get all the legal documents done way before you have to go in for surgery. I have not shaved my legs for 3 days before surgery. That's something that I never thought of as a man. I've arranged for someone to drive me home when I'm discharged from the hospital. I've arranged for someone to drive me to my follow-up appointments. I've arranged for somebody to drive me to physical therapy if that's going to be prescribed. You want to know if you're going to have in-home physical therapy as part of home health. You can also have in-home physical therapy as part of outpatient therapy services, or you might be going to an outpatient therapy clinic. These are things that you need to know ahead of time so that you can plan, you can schedule. And if you've had your pre-op physical therapy session already, the therapist will help you know what's going to be best, what's in the cards for you after surgery. To improve my health before surgery, I quit smoking. Awesome. I had a dental checkup. You know, dental cleanings, dental checkups, get as much of that stuff done before surgery, because it's a headache. You have to do antibiotics and you have to go do a couple other things if you try to do it after surgery. So if you're on the bubble, get it done before surgery. Receive the flu vaccine. I'm eating lightly the week before surgery just to kind of help keep the GI working better, reduce the risk of constipation. You've increased your vegetable intake. You've talked to somebody about your particular dietary requirements and what's going to work best for you. I've had my diabetes checked. So hopefully if you are type 2 diabetic, you're monitoring blood levels, you're looking at that. And you know, talk to somebody, ask the question, well, what happens if my sugars shoot up to 200, 300? What do I do? You want to have a plan in place. Hopefully they don't, but you want to have a plan in place. All right, guys, in the next video module, we're going to talk about what to bring to the hospital. I'm going to save that for the next section because that's when we're going to get into the 24 hours before surgery through the 48 hours after surgery. Take a break, look at what we've covered, go back and maybe even watch this again. But you guys are going to be so prepared for this procedure. It's going to completely change the way you experience post-surgical recovery compared to someone who maybe isn't as well prepared. Guys, I'll catch you in the next video.